Thanks for staying with us. We're going to try and take you back to that interview that we were unable to do a short while ago. We're going to connect with Professor Laetitia Rispel. She is the Professor of Public Health with the Wits Health Workforce, and she joins us now to talk about the fact that we've got a healthcare workforce in crisis. That, of course, is not new news, but the fact that almost half of our nurses are set to retire in the next 15 years. That indeed is what Professor Rispel has called a crisis of an aging workforce. Professor, thank you so much for joining us again. This is an international problem. You've admitted that. But why is this particularly concerning for us here in South Africa?
Good evening, Marcel, and good evening to the viewers. I think one of the issues is that we're already facing with shortages in South Africa. And South Africa has, as many people know, what's been referred to as a quadruple burden of disease. So we have a very complex and heavy burden of a combination of, of diseases. And so if we look especially at the historical neglect of the health workforce and of nurses in particular, we look at population projections, certainly we should be concerned about dealing with the matter in an urgent manner.
Now, if anything this pandemic has taught us is that whatever we are paying or doing to take care of our health workers, it's definitely not enough. And now this information comes just to almost magnify in what kind of crisis our healthcare workforce is. Nurses retiring at a certain age is one issue, but they also take with them a wealth of experience. That must be even more concerning, and not just the numbers of nurses that will leave the workforce to enjoy a well-earned retirement.
Yes, it's the experience that you have to consider, Marcel. In addition to the numbers and the crisis that we're facing, it's also the wisdom and experience that these nurses will leave with. And so we really need to implement a combination of strategies. Of course, some of the nursing education reforms have to be implemented. There has to be very high-level intervention and leadership from the National Department, of Health. We also have to make the profession of nursing more attractive, and we have to take steps to make sure that those young individuals who do enter nursing and who do community service, often many of them are unable to get posts after they've completed their community service. And so certainly we should be making sure that we attract young people and that we retain them in the health system.
The retaining of the nurses in the health system, I know, has been a topic of conversation for a long time, specifically when we hit the hard part of lockdown last year, because there was talk of how so many international destinations would be desperately looking for well-trained nurses, as our nurses are here in South Africa. And because they're being paid well and they're looked after better in terms of benefits in various international markets, South Africa would be losing quite a bit of its nursing workforce through that. What can we do to retain our nurses here?
Certainly, I think we have to demonstrate that we value them, Marcel, through a positive practice environments. We have to, especially for community service nurses, we should ensure that there are posts, especially in underserved areas, once they complete their community service and they want to stay there. And of course, there should also be adequate supervision and support for these young nurses.
We're speaking about retaining the nurses, but how do we attract new nurses? We're being told that young people are not seeing it as an attractive career options. How do we do that?
I think we could do that through a combination of measures, Marcel. We could certainly use some of the excellent role models that are there to go to schools, and make the people aware, of a very rewarding profession in the health services. Of course, we should, also, once they're in training, because often they enter the nursing profession, but some of them leave, because for a combination of factors. And again, once they're in training, we should make sure that they are role models, and that they're shown that the health system cares for them. But I think it is a critical issue, Marcel, that when you also have younger people that you retain, they're also more likely, and if they experience a caring and a positive health system, they're more likely to tell others, and certainly the younger generation about it. And in that way, we begin to have a virtuous circle.
Okay, we're going to leave it there. Very important points made there by Professor Laetitia Rispel. She is with the Wits Health Workforce, a crisis South Africa's health force is facing, with a large number of nurses set to retire within the next 15 years.